Okay. Okay. Thank you very much, Zainab. As I said at the beginning, we're going to record this entire session so that we, COI, can take notes and send out a detailed summary at the end of this training. And then we're going to keep a portion of the recording, the portion that is around safe sleep, SIDS, and SUEDS, and we're going to post that to our website. Unfortunately, we're not able to repost the section on breastfeeding, but that's fine because like I said, we're going to send out some detailed notes. So first, I just want to welcome everybody to this Promoting Safe Sleep and Supporting Breastfeeding in Childcare Settings training. We're so lucky to be able to have the early childhood work group hosting this for us. And we're really happy to have Jamie Felice, Kim Elkins, and Kim Specken here to facilitate for us. I'm going to turn it over to them, but I just wanted to let you guys know that when they break and ask for questions, feel free to unmute yourself. Also, feel free to put questions in the chat. I will monitor that and I will let the facilitators know when there are some questions. And then at the very end, we're going to have 5 minutes to just fill out a short evaluation, just 5 questions or so to kind of learn about how satisfied you were with the training, what you learned, and what you're thinking about implementing. So I'm going to go ahead and ask everybody to put your microphones on mute if you're not asking a question or facilitating. And I'm going to turn it over to our first speaker, which I think is Kim Elkins. Is it? Or is it Jamie?
I think it's Jamie, but I'm happy to go first.
That's right. We said Jamie's going to go do the sleep first. Okay, so I'm turning it over to Jamie Felice.
All right. Well, thank you, Jackie, and good afternoon to everybody. Thank you, Early Childhood Domain, for welcoming me today. I'm going to share my screen as I introduce myself. I am a senior public health nurse, and I am also a lactation consultant. And my role is I am the SIDS coordinator, perinatal services, and lactation coordinator. And I'm really grateful for the intersection where lactation really covers all of those roles, and especially learning about how human milk feeding, supporting breastfeeding is actually a SIDS reduction effort. And so I'm really happy to be here this month, especially in the month of October, which is SIDS Awareness Month, also perinatal loss awareness month. So thank you again, Jackie and everybody, for having me today. So some of you may be very well familiar. I know I have a lot of county colleagues on the call today. You know, it's a vision of Live Well San Diego to support communities to live better and to ultimately thrive. And as a SIDS coordinator, I help to oversee. We have public health nurses in the 6 regions of the county, and we support families who experience sudden infant death. But the other half of my role, you know, we do support the families who are experiencing the grief and the trauma, but we also help to educate the community and how we can reduce the risk for SIDS. And so that really falls under the thriving part, and I'm really happy to be here connecting with my lactation colleagues to support our communities to thrive. So we have some objectives today. Some of you may be familiar with these terms: SUID, sudden unexpected infant death, and SIDS is sudden infant death syndrome. They are actually 2 separate terms, even though they are often used interchangeably. We're going to talk about the risk factors for SIDS, as well as ways to reduce the risk. And that's really all that we know that we can do. And I'll talk more about that. But we're also going to talk about 3 known protective factors that protect against SIDS. And that's why we're here today. So sudden unexpected infant death is the death that occurs from a baby between 1 month to a year of age that happens suddenly and unexpectedly. Now, that can happen. There can be after an investigation, an autopsy, and certainly when there is a sleep-associated death here in San Diego, there's a full investigation that occurs. So at the death scene, whoever cared for the infant last, they will collect anything that the child may have ingested, from milk in a bottle, formula, medications, diapers. And they also do a full autopsy. And after they do that full investigation, that full autopsy of that sudden and unexpected infant death, they may find that the child died due to, for example, suffocation, which can happen if the baby's airway is blocked somehow, some way, maybe from a soft bedding or a blanket. It could be an entrapment, and that happens when the baby is wedged between 2 objects, like a chair or a sofa and the cushion, or the bed and the wall. Or there could be an underlying infection, you know, a bacterial infection or a virus that would be identified, or that maybe wasn't identified, or a metabolic disorder, or maybe a cardiac dysrhythmia. It could be trauma, it could be visible trauma, or it could be accidental or shaken baby. Either way, they're going to find out the cause of the death. But in the absence of an actual identifiable cause of death, but everything else, there was none of these other causes that I mentioned, then it is a SIDS. So SIDS is really a diagnosis in the absence of a diagnosis. And so what we know then is that SIDS is a type of SUID. We know that it's a sudden and silent medical disorder. There is a medical diagnosis for SIDS. We know that it's associated with the time of sleep, and that can be during the day or at night. It doesn't matter, but it is associated with sleep. But it is the leading cause of death. Deaths for babies between 1 month and a year, with the bulk of those deaths occurring between 1 and 4 months, but majority of them happening before they reach 6 months of life. And we're going to talk a little bit more of why that is, but the main reason to that is there is rapid brain development happening in the first 6 months of life. I mean, truly the first year of life, but especially in the first 6 months of life. And so the baby is learning to regulate life outside of the womb. And if a baby has some underlying issue that we haven't yet identified, some of those babies may have more trouble. So we also know that SIDS can happen to any family. It does not discriminate. It affects all social, economic, and ethnic groups. But what we have found is that it's about 2.5 times more likely to occur in African-American infants. And this is disturbing. And there are reasons that we have learned why this is happening. And we're going to talk a little bit more about that also. And I'll share a little bit of how we are trying to address that disparity. So I mentioned, SUID, sudden unexpected infant death. These are the rates from 1990 to 2022. But they also have the other causes broken out, and you can see that SIDS is in blue, and then there's unknown. So those would be cases that did not have an investigation or autopsy. And then ASSB is accidental suffocation, strangulation in bed. So you can see that there was a significant drop. There were a lot of babies dying. In 1990, 154 per 100,000 live births. But you'd see from 1990 to approximately 1996, there's been a significant drop. And if we were in a room, I would ask you if anybody might be able to guess why that may be. But I don't know. I can't see the chat. I don't know if anybody wants to chime in the chat. What do you think might have happened during that time that caused or that prevented so many infant deaths? Does anybody want to try?
I have an idea. Oh, someone says back to sleep campaign.
Yes, ma'am, or yes, sir. Good answer. You are correct. That was the intervention. And it's a very easy one. And you can see that it saved or prevented a lot of deaths. While SIDS and SUIDs still happen, we have learned a lot from the Back to Sleep campaign, and also the reporting has improved since the 90s. Although it's still a little bit sticky because the terms and the way that states diagnose SIDS may differ. So this is looking at the United States. And then for the same time
Para
frame,
ver si ese es otro. Let me see. ¿Me lo mandaste, Zeita?
Please mute yourself.
Ah, este es el.
okay,
Okay.
thank you. So these are the same years, and we're looking at San Diego. So we can see San Diego County, SUID is in purple, and then we have SIDS broken out into blue. And you'd see that the same shift happened in San Diego. Sadly, though, we still have cases, and that is why we're here today, trying to learn how we can prevent them from happening at all. And I wanted to share this slide with you because we mentioned that SIDS happens, 2.5 times more frequently in our African American infants. But you can also see that our Native American infants are also taking the weight of SUID and SIDS in the US. And this is really probably attributable to a multiple factorial reason, but a lot of it is reflecting back to access to care and to potential poverty levels, lack of access to early prenatal care, lack of access to lactation support, limited access to support after the baby is born, to support them with breastfeeding and safe sleep and whatnot. So I wanted to share that because it is significant, and it it really fires me up to learn more about my work and to learn again how we can educate and help improve these outcomes. So we know that there are risk factors for SIDS. You may already know this, that there's no cure. We only know the risk factors, and we can only limit the risk factors. So we're going to talk a little bit about that now, so that you may just already have it in mind if you're caring for a child that has any of these. So with the triple risk model theory, this is what we think is happening when SIDS happens. And when the three come together, that's when a SIDS death is more likely to happen. And I'm going to explain what that means. So when you have a vulnerable infant, that's an infant that may have an underlying issue that perhaps we haven't yet identified. Okay, or maybe this is a vulnerable infant who was born prematurely, or who has some other underlying risk factor, a health issue, okay? Then you have a critical developmental period, which I stated earlier. The first 6 months of life are especially, there's rapid brain development happening during that time, which is probably why, approximately 90% of SIDS deaths occur before 6 months of life. But the third factor then, the outside stressors, that's the part that we have control over. So that's the part that includes, and this is what's modifiable, okay? So this is what includes the safe sleep environment, right? So a firm mattress versus a loose bedding or an inappropriate sleep surface or a smoke-filled environment. These are the things that we can control, right? So if we can provide the best safe sleep environment with the correct position back to sleep for every sleep in a smoke-free environment, keeping the infant from getting too warm, providing human milk, which I'm going to get into here coming up. We know then that we are reducing the risks. And though we know that there's not one single risk factor that's likely to cause a SIDS death, we know that it's actually the convergence of several risk factors. But we know that we have control over the outside stressors, and that's really the take-home point from the triple risk model. So which infants are at greater risk for SIDS? Well, we know that it's to the young mothers with late or no prenatal care. We know that it happens with more frequency in males. It also happens in more frequency in multiples. And I already showed you the slide about African American and our Native American infants, and then as well premature and the very low birth weight infants. And actually studies have shown that a study has shown that premature infants are up to 17 times more likely to die from SIDS than a term infant. So again, it's just something to know, just the association. But we also know that it's to those infants who are exposed to nicotine and tobacco, either in the prenatal period or in the outside of after birth environment. Infants born to prenatal or illicit drug and alcohol use. Infants sleeping on their stomachs, soft bedding, and the overheating. So we know that these are risk factors for SIDS, which again, all of this is what's modifiable. It's what we can help control. But I wanted to talk about this slide with you today because, some of you may not be aware that SIDS, actually quite a few, about 25% of them, occur when the baby is being cared for by someone other than the parents. And that, about a third of the SIDS deaths occur within the first week of a child being new to daycare, with even half of those occurring on the first day. So I have been involved in SIDS my whole 9 years I've been with the county, and I have cared for families who lost their infant at a daycare, and it's tragic. So even, a family that I cared for, they lost their son on their second day at childcare. So it's really important then that whoever is caring for the child, that it's the same, we put the child to sleep the same way everywhere with whoever is caring for the child, that we put them in a safe, empty, firm, fitted sheet, mattress, empty, no blankets on their back for every sleep at childcare or at home. And in the event when this happens, and we had one, a death maybe in the last 2 years. And what happens then is we have public health nurses who will obviously provide support to the family of the deceased child, but we will also send a nurse to provide education and resources and support to the daycare, because we know that it has a ripple effect, and it's traumatizing to everyone who is involved. So that's how we support families and daycares when a SIDS death occurs at childcare. So I wanted to share with you also the and I hope that at the end of the training or at some point Jackie will be able to share the resource with you, but I'm going to talk to you about the recommendations from the American Academy of Pediatrics 2022 updates for reducing sleep-related deaths. And we'll share that that policy with all of you today. But you know, this is what they say for all sleeps, okay? So placing baby to sleep on their back for every sleep. So for naps and at night on a firm and flat sleep surface. The provision of human milk, so either breastfeeding, either from the breast, expressed in a bottle, or if donor milk is available, is the recommendation. So the American Academy of Pediatrics recommends 6 months of human milk feeding of exclusivity with feeding up to a year or longer, however long the parent and baby are happy. But 6 months of exclusivity is the recommendation, and we know that it helps to reduce the risk of SIDS. They also encourage room sharing, not putting any soft objects in the baby's bed, no smoking in the baby's environment, providing a pacifier for naps and nighttime, that this has been shown to be a protective factor, that it may keep baby from going into an unarousal state of sleep. I mentioned not to overheat, no bundling or hats for baby sleep, lots of tummy time, following healthcare provider guidance on vaccine schedules and regular health updates. And then at all costs, avoiding products that go against safe sleep recommendations, and also products that say it will protect your child from SIDS. Avoid those because there's no such thing. But we also know that the identified protective factors are immunizations, again, keeping up with the childhood, the infant recommendations. We know that SIDS can happen with underlying infections, right, from viruses or bacterial infections. So keeping up with the immunization schedule. I mentioned pacifiers in the last slide, that they've shown to be protective. But breastfeeding has shown to be protective, and the protection increases with duration and with exclusivity. So what that means is the longer that a child receives human milk, and I know I said that the AAP recommends 6 months of exclusivity, but up to a year, the protection for SIDS increases, again, with exclusivity and duration. But however, any amount of breastfeeding is protective, and we really need to support families prenatally. We need to support families after the baby's born, but really providing that education, knowing that that is something that they can do for their child to help reduce the risk for SIDS is empowering, and we should know that too. So the benefits of human milk feeding, why it's protective. Well, again, according to the American Academy of Pediatrics, it is the normative standard for human infant feeding because it contains the precise mix of water, nutrients, fats and carbohydrates, and vitamins. It also helps to establish the infant gut, which helps to establish their immune system. So, the parts of breast milk, human milk that cannot be replicated are the specialized fat, so the long chain essential fatty acids, and then also the type of sugar, the oligosaccharides. They can't be replicated. So those are highly specialized, and they're specialized from that parent and for that infant. So it's really really specialized. And the other thing too that's important to know that when a baby is being exclusively breastfed, they do not need to have any water supplementation. Even when it's hot, if they are getting enough milk, it satisfies everything. So in public health, we need to teach families and providers that we need to educate our families that there's risks of not breastfeeding. And again, we talked about the benefits. So then, an infant who's not provided human milk, who's not breastfed, may be at greater risk for SIDS due to the reduced immunological protection. And the reason why breastfed babies wake up frequently, you might hear about that, it's because breast milk is highly digestible. So it's a good thing that they wake up with more frequency. I mean, that could be part of the arousal, is that they wake up because they're hungry. And the American Academy of Pediatrics states that breastfeeding, it really is a public health issue. The benefits extend beyond the infancy stage, for both mom and baby, and ultimately for our communities. Breastfed babies miss less days of school, less days of daycare. Parents miss less sick days at work. So breastfeeding promotion then is also a risk reduction strategy. And again, this is according to the American Academy of Pediatrics 2022. And we know that in other wealthy nations that have good prenatal, postpartum support, they do not have the rates of SIDS that the United States does. So the countries where, families have extended leave and more support, they do not see the same rates of SIDS that we do. The US actually doesn't have, we don't fare better in a lot of areas, and SIDS is one of them. So we know that structural barriers are, they contribute to this, that, I mentioned that there is limited access to high quality lactation support. We know also that, we mentioned that, African American and people who have limited access to prenatal care are more likely to have birth and postpartum complications. And, they're likely to have to return to work earlier, and who knows if their workplace environment has lactation laws in place to support them. But, in contrast to other, middle and high income countries, the United States really lacks, large scale support for families like this, not limited, to lactation support. And we also, a lot of us, I'm sure some of you may be parents yourselves, that, we have a lack of, guaranteed paid family leave. So a lot of families may be, forced to have to end breastfeeding sooner than they want to and have to return to work. Parents may also, be really desperate for sleep. And so they may, give in to less than safe sleep practices, and the child may also be cared for a variety of caregivers. So these are really issues, true issues affecting even communities here in San Diego, that, you're also caring for these families too. So a lot of people ask about the side lying, and they think that it may be just as safe as putting a baby to sleep on their back, but in actuality, it's not. It may be safer than putting the child to sleep on their stomach. It's actually still 2 times as risky for them to be than on their back. So it's not a safer alternative. But I want to show you why we believe, or why it's known that there is a physiological protection when the baby is sleeping on their back. And you'll see here that this is the tube from the esophagus in the baby that's sleeping on their back here, and that's the tube to the stomach, and that lies underneath the trachea, which is the airway, right? So if a child spits up the contents in their stomach, if they regurgitate, it's going to pull in the back of their throat, and it would have to travel up above gravity to go into the airway. It's also believed that when the fluids pool in the back of the child's throat, they're actually able to clear the secretions easier when they're on their back. And then if you look at the baby who's sleeping on their stomach, the tube to the stomach, the esophagus, is lying on top of the trachea, which is the airway, which is right here. So if they spit up the contents from the stomach, then the contents are able to travel and aspirate into the lungs easier than if the child was on their back. So this gives an anatomical protection then, and you can understand why that is, why it is actually a protective factor to place babies on their back to sleep. So what does a safe sleep environment look like? Well, it looks like this. And this is a great example of a sleep space, a crib that has a firm mattress, just with a simple sheet covering the mattress. There are no pillows, there are no stuffed animals, there are no blankets in the sleep environment. The baby is dressed in a sleepable outfit, like a footed pajama or a sleep sack. The baby is also positioned on their back. They're in a smoke-free environment. They are not in a chair or on a couch. And it looks like they would be sleeping near the parent, which again, according to the American Academy of Pediatrics, they encourage room sharing for either for easy access for breastfeeding or just to have the baby in the parent room. So oftentimes parents are concerned that their babies' heads are becoming misshapen. So if they, from sleeping on their back, but the key is really to give a child lots of tummy time. I'm sure a lot of you have education in child development. You know that that's plenty of playtime, plenty of allowing them to develop their musculature. Tummy time helps them build up their chest muscles and their neck muscles, prepares them for crawling. And also just trying to avoid too many seats and keeping them in the car seats and the swing seats and the other seat and the having them out of seats and using their engaging their muscles is the way to avoid the misshapen head. And while we can't really tell you what products to use, we can encourage folks to look up for safer products themselves. There are a few websites. One is the saferproducts.gov that you can, look up any recalls or if there's any other hazards. And then there's also the Consumer Product Safety Commission that helps inform the public of any other type of risks associated with any or injuries that have been associated with any infant equipment. So I have additional SIDS information. You are welcome to write down any of those websites. And I'm also grateful for the opportunity to share this information with you all today. I'm happy to try to answer any questions that you may have. And if you have a moment or two, we really appreciate you taking our survey. It helps us to improve our trainings for our colleagues and community partners. And that is my presentation for you today. So thank you again for having me. I'm happy to try to answer any questions anybody may have.
Yeah, there are a couple questions in the chat. One
Okay.
is the protection from breast milk alone, or is the protection coming from the act of sucking from the breast, or both?
That's a good question. I would probably say it's the actual human milk feeding because it is alive and it's full of immunoprotectant factors and special ingredients. So I would say it's the actual breast milk itself or the human milk itself.
Okay, Kim S, our other, another IBCLC also says in the chat that both could be protective because of like the sensory exchange that's happening between breastfeeding and the parent, between the breastfeeding parent and the baby, that could provide affect arousal states, which is information from, is it Niles Bergman?
Oh,
It
mhm.
it is, yeah,
Okay, Niles. Mhm.
yeah.
And then someone also asked why a pacifier is a protective factor.
Yeah, so I think it's kind of piggybacking on what Kim S said, that it's the suckling that that is comforting, that may prevent them from going into too deep of an aroused state or a non-aroused state. And of course, the child will fall asleep and they'll spit the pacifier out, and that's fine. It's just a way of putting them to sleep with the pacifier that is seen to be protective. Yes, I can share the link for the survey. Yes.
Okay.
I don't know, does any of the Kims have anything to add to the pacifier?
I don't know the science behind it, but yeah, I think it's just, well, a theory, right? We don't know any of this for sure, but keeping the infant at an arousal state such that it's not able to go into such a deep state to not
Mhm.
self-arouse. So, and that's also the theory why breastfeeding can be protective, is that there's so much interaction, sensory exchange between the breastfeeding parent and the baby that also just keeps that baby at an arousal level that isn't possibly risky.
And again, and it's for those infants that we don't know. We don't know who may have, and where the research is leading us with SIDS is actually looking at the brainstem, that there may be a deficit in the neurotransmitter serotonin that helps, the brainstem helps with the drive to breathe and the drive for heart rate and the drive for to regulate blood pressure. And so there has been research that shows that SIDS victims may have a deficit in that neurotransmitter, but we don't know that until after autopsy. So to Kim's point, if that child, those babies that may have trouble with arousal, or that who could get into trouble, they're the ones that would especially benefit from the pacifier and from the safe sleep environment, as all babies do. And it looks like someone also chimed in, and I love that. Correct. Yes. I'll chime in. Teresa, thank you. Teresa Hardesty, MD, says babies who are breastfed or fed express milk are at lower risk for SIDS compared to babies who were never fed breast milk. Exactly. That is that's why any milk is beneficial, but of course the guidelines are to give exclusive milk for human milk for 6 months. Thank you for that.
And you guys will see in the chat, I dropped a safe sleep infographic, and then also the American Academies of Pediatrics updated recommendations. Dr. Hardesty put another resource link in there about breastfeeding and SIDS from the National Institute of Health. And why don't we give everybody just 2 minutes to either go use a restroom, have a drink of water, or fill out this Survey Monkey for Jamie that I just put in the chat. And then when we come back, we'll be diving deeper into breastfeeding. Sound good, everyone? Okay, I'll see you back here in 2 minutes, 3:43. Friendly childcare portion.
Thanks, Jackie. Welcome back, everyone. I'm Kim Elkins, and Kim Speckhahn and I want to thank you for joining us today.